I'm Richard, and we're here today to continue the Star Trek exercise series, Part B. The 1965 TV show inspired many people with their uniforms and a Hollywood look, and it is still a popular show around the world even today. The uniforms consist of a sort of a tight fit, and they are very much recognized for their physical fit look and also their bold colors. So as we go to learn about the diaphragmatic exercises, you can look at the first video, which covered the AEIOU video for the breathing exercises for the upper diaphragm. The lower part of the diaphragm can be studied from a different vowel perspective, and that's the Y and W vowel. So let's go look at this now and see how it's going to impact us to boldly go where no man has gone before. Okay. Today we're going to talk about the Y and the W breath. First, let's talk about the Y breath. The Y breath has basically two arms to it. Breathing in and breathing out. And when you do this breath, we want you to understand that we want to get all the air out very, very quickly. So when you use the tongue in the outside position where it's touching your nose like that, take your inspiration and then blow. The first breath will be, the Y breath will be very quick. So it's the second one is a little longer, so you want to let that one go out a little bit longer. You want that about 10 seconds. So to slow that breath down, you kind of make a little yup yup sound like real fast, and that's kind of the count that you want to use. The other thing is it connects to the lower body, so we want to basically move the legs in this position out. That's called supination, and then you have a pronation of the ankle. And so you're moving your hips and your ankle in that one movement. So on the first short one, you want about 3 of those. So you breathe in, breathe out as you count to 3 with the legs. So it's like this. So in 3 seconds, you basically have all the air out. The second one is the long one. Now this one's going to be slower, and you won't see any of the air hitting the balloon much. But it'll be kind of slow. So in that breath, you can see that as you expire your air, your oxygen is being absorbed. So actual research studies have shown that the PaO2 should rise on everybody. So that's what that one does. The first arm kind of lets all the air out very quickly and kind of cleans the airway slightly. So the two of these things together should increase your energy and also clean the lung. Let's go to the W vowel. The W vowel is more of a inspiration, expiration, inspiration, expiration, inspiration, expiration with the W breath. The purpose of this breath is you're going to put about 5 of the exercise with the pronation, supination of the legs into this area, and here. So as a result, you're actually going to be doing some physical movements down below, but it's mainly when you breathe in, breathe out nice and full, then basically you're going to have a little increase in the stroke volume when you do this. And that just means the blood will get more into the heart. And so here we go. And in between, I'll move the legs to show you. So it's in, out, there's 5. Now we'll go up to the lips again. In, last one, in, count, and 5 count. Now on the W position, the tongue is actually in front of where the E vowel was. Remember the E vowel? It's in front of it. And what it does is it allows the tongue to move forward, but that opens up the space in the back, allowing for clearer breathing, bigger breath into the lower rib area. And it also allows the sound to sound a little bit more in the frontal area. And also it gives you the tongue position just in front of the incisors behind the lip. So that is the W vowel. Now you can see you can't talk with that very well. So you're doing your breathing through the nose. So that's the Y and W breath. I hope you try this. You can do it in the bed, laying down, as long as you keep your head up slightly in the bed, and then you can do your pronations, supranations for a count of 5. The Y breath is done first, usually, with the count of 3. And also count of 10 for the long side of the Y vowel. So you can see it's a much stronger expiration in the Y breath than there is in the W breath. The W breath is just in and out, very relaxed, not doing anything. You're just basically relaxing and letting the count go. And these exercises are very important to kind of restore this lower body exercise, diaphragmatic movement, as opposed to the high upper diaphragm movement. And when you don't feel the rib bending exercises in here, don't be frightened or scared. You'll get it. You just work the lower abdomen as a little bit more, gets the strength, and then sooner or later you'll be able to go back to the AEIU breathing techniques as well. So I hope you enjoyed today's Y and W vowel training session, and look forward to having you watch part A and